baby had a hip ultrasound scan to check their hip joints? Wondering if you need to be doing something with those results? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to talk about the significance of hip ultrasound scan results for your baby's hips. So here at My Favourite Physio, we recently had a family come to us rather concerned about their baby's hips because they were told to do a hip ultrasound scan and they weren't sure if they should be doing something after that. So this little one is now 8 weeks old and mom was asked to do a hip ultrasound scan at 6 weeks old because there was a query of a clicky hip. She did the scan and then was told, let's just wait and see. But mom didn't feel right, so she came to us for an opinion. This baby's hip ultrasound scan showed that the hip joint only had 38% coverage. That means in your hip joint, if that's your thigh bone and your pelvic bone, that makes your hip joint. Babies should have good coverage of their hip joint to allow them to then be able to walk on their hips later on at 18 months old. This baby had 38% coverage, meaning less than 50% of that hip was actually covered by the pelvic bone. What that means is baby doesn't actually have a very good hip joint and will not be able to walk on it when they stand up in future. So really, that baby needed immediate treatment with a harness like this one. The aim of a pelvic harness is to correct their hip joints to promote normal hip joint development so that baby can have a healthy hip to walk on in future. So we immediately advise that that baby actually needs immediate treatment and that should be done immediately and not waiting any more longer. So just as a brief guideline for those parents out there, if you've had a baby who's had to have a hip ultrasound scan, here's the guideline. If the hip coverage is less than 45% at rest or at stress, your baby actually needs a pelvic harness. Not double nappies. Do not wait because you'll be losing a lot of time where we could really correct baby's hip joint. Often, if the coverage is between 45% to 55%, doctors would advise to wait and see for 6 more weeks before you get another ultrasound scanned. Here in our clinic, we actually carry out a full assessment of baby's hips, and we do explain to parents that they have the option to put a harness on when their hip joints are between 45 to 55% coverage. Optimal coverage for a baby should be 60%. And so in that gray area, 45 to 55, often they're told to wait and see. Yet for us, in our experience, waiting and seeing means that we often end up seeing adults later on having early hip pain, early arthritis, because their hip joints was less than optimal. So we do advise families, if you are concerned of your baby's hips, and if we carry out a few tests and baby's hips don't open well, we do offer the options to have a pelvic harness on as well. So if you're out there and you've got your baby and their hips ultrasound scan, is it less than 45%? If it is less than 45% coverage, you need a pelvic harness. If it's between 45 to 55, you may have the option to wait and see, or you could have the option to have a harness. If it's 55 to 60% and above, your baby's hips are healthy and fine. So if you're concerned about your baby's hips, why don't you ring us here at My Favourite Physio? Speak to one of our expert pediatric physiotherapists. The number to ring is 02-9790-4233. And if you know somebody out there who has a baby and they have been told baby has clicky hips and they've had some scans and not sure what to do, why don't you like and share this video with them? Until next time, have a great day. Bye.